Chapter 11, the muscular system, part 3. So there are 6 eyes that help to move the eyeball. You have the 4 rectus muscles, which are all named where they're located. So you have the superior rectus muscle attached to the superior anterior region of the eyeball, the medial rectus on the medial side, the lateral rectus on the lateral side, and the inferior rectus on the inferior side. Conveniently enough, they all move the eye in the direction they are located. So medial rectus moves medially, superior rectus moves superiorly plus a little medially, inferior rectus moves inferiorly plus a little medially, and lateral rectus moves laterally. Then we also have the 2 obliques. The superior oblique, which comes from the back of the orbit, makes a U-turn and then attaches to the posterior side of the eyeball, and the inferior oblique, which has its origin in the front of the orbit and then it inserts into the posterior side of the eyeball. The superior oblique moves the eye inferiorly, goes a little laterally, and the inferior oblique moves the eyeball superiorly, plus a little bit laterally. Don't let that confuse you. All right, muscles that are important for mastication or chewing. We have the temporalis muscle, found on all sides of the skull, inserting into the mandible, and the masseter muscles, going from the zygomatic bone down to the mandible. Also, deep inside the head, we have the medial pterygoid, going from the sphenoid bone down to the mandible. These 3 muscles all help to elevate the mandible so that we are able to lift our jaw when we chew. The temporalis elevates and retracts or pulls back the mandible. The masseter elevates and protracts or pulls forward the mandible. And the medial pterygoid elevates and protracts the mandible and also helps do that side-to-side movement of the mandible that we so rarely need. To help lower the mandible, we have the lateral pterygoid, another deep muscle going from the sphenoid bone down to the mandible. And it helps to protract as well as depress or lower the mandible and also helps in that side-to-side movement. Moving on to the muscles of degglutination or swallowing. There's a series of internal muscles in our pharynx or throat that sequentially will contract to propel food down to the esophagus. These includes the superior pharyngeal constrictor, the middle pharyngeal constrictor, and the inferior pharyngeal constrictor. Muscles involved in speech. We have a number of muscles that help to move the tongue. The genioglossus muscle going from the inside surface of the mandible up inserting into the tongue. We have the styloglossus muscle going from the styloid process of the temporal bone and inserting into the tongue. And then the hyoglossus going from the hyoid bone and inserting into the tongue. Genioglossus protracts or pulls forward the tongue. Styloglossus elevates the tongue and retracts it or pulls it back. And the hyoglossus depresses the tongue and also retracts the tongue. Then we have the stylohyoid muscle. Its origin is the styloid process of the temporal bone and it inserts into the hyoid bone. And it helps to elevate the hyoid and affect the larynx. We also have the sternohyoid muscle going from the sternum and inserting into the hyoid bone. It helps to depress the hyoid. And then with the omohyoid muscle, which is a weird two-belly muscle that's in origin is in the scapula and it inserts into the hyoid bone. And it also helps to depress the hyoid bone, and then also depress the larynx. We also have the sternothyroid cartilage going from the sternum up to the thyroid cartilage that helps to depress the thyroid cartilage of the larynx. And then we have the thyrohyoid cartilage going from the thyroid cartilage to the hyoid bone. And this helps to elevate the thyroid cartilage, or it can do a reverse muscle action and depress the hyoid bone. Continuing on in this region, we have the digastric muscle. This is a two-belly muscle. It can help to pull on this connective tissue in order to elevate the hyoid bone and the larynx, or it can do a reverse muscle action to help depress the mandible. So it could be involved in degglutination. And then there's this thin sheet muscle at the very bottom of the jaw, as you can see here. It helps to elevate the hyoid bone and elevate the floor of the mouth. Mylohyoid muscle, mylohyoid. All right, then we have the sternocleidomastoid muscle. It's the right and left one. They are on either side of the um, neck. Their insertion is in the temporal bones mastoid process. Their origin is the sternum and the clavicle, hence the name sternocleidomastoid muscle. Together, working at the same time, they will flex the cervical vertebra and the head, allowing us to look down. And singly by themselves, they'll laterally rotate the head in the opposite direction of that muscle, or help to laterally flex the head, lie the head sort of on the shoulder. In the posterior side of the neck, we have the semispinalis capitis muscle, a deep muscle, and we have the splenius muscle, which is slightly more superficial. Semispinalis capitis muscle, together when both the right and left one work together, they'll extend or pull back the head and neck. Acting singly, they will laterally flex the head or neck, letting you lie your head on your shoulder. Splenius capitis muscle, together they will also extend the head and the neck. Singly, they will rotate the head in the same direction of that muscle. Then we have these rather deep muscles, the scalenes. We have an anterior scalene, a middle scalene, and a posterior scalene. They all do the same things. They help to elevate ribs 1 and 2 during deep inhalation. They reverse muscle action, allowing us to flex the neck. Moving on to the muscles in the back or posterior region, there are three main series of muscles. You have the spinalis thoracis muscles lying on the vertebral column, as it were. You have the semispinalis thoracis muscles that are adjacent to the vertebral column and attaching to the ribs, and then the iliocostalis thoracis muscles that are even further lateral and also attaching to the ribs. The iliocostalis thoracis muscles together will extend the vertebral column, allowing you to raise up from a bowing position, or singly allow you to laterally flex the vertebral column to lean over to one side or the other. Semispinalis thoracis muscles together will extend the vertebral column. Singly, they will help to rotate the vertebral column to the side opposite the contracting muscles. And then the spinalis thoracis muscles together will help you to extend the thoracic vertebral column. And that's it for that one. All right, we also have at the lumbar region the iliocostalis lumborum muscles, which are actually sort of extensions of the iliocostalis thoracis muscles. The iliocostalis lumborum muscles help to extend the vertebral column, and also when they act by themselves, laterally flex the vertebral column. Then we have the diaphragm. This is a large sheet-like muscle that forms the border between the thoracic cavity and the abdominal cavity. It is very important for breathing. The muscle is normally a bowl shape, but when it contracts, it'll flatten out, pulling down, expanding the volume of the lungs and the thoracic cavity, allowing air to come in, inspiration. It also can push on the abdominal organs, increasing the pressure on the abdominal pelvic cavity. Its origin is huge, basically going all the way around the trunk of the body, all the way around. So inferior surface of ribs, 7 through 12, xiphoid process of the sternum, costal cartilage of rib 6, the lumbar vertebrae, and its insertion is into itself, into its own central tendon. Then we have the external intercostal muscles, slightly more superficial. They help to elevate the ribs during quiet and forced inspiration, so expanding the thoracic cage. Origin inferior border of superior rib. Insertion is the superior border of the inferior rib. So again, elevating the ribs. Deep to them are the internal intercostal muscles. These help to depress the ribs during forced expiration. You breathe out really hard. Their origin is superior border of the inferior rib. Its insertion is the inferior border of the superior rib, so it helps to lower the ribs. We also have the muscles of the abdominal wall. We have the rectus abdominis, these two sheet-like muscles in the very anterior region of the abdominal wall. They help to flex the vertebral column, allow us to bend forward as well as compress the abdomen. Their origin is superior surface of the pubis. Their insertion is the xiphoid process and inferior surfaces of ribs 5 through 7. Then we have the external obliques, these lateral muscles on the side. Together, the external obliques can compress the abdomen and help to flex the vertebral column. Singly, they can laterally flex, allowing us to lean over, or laterally rotate the vertebral column. Origins, the external and inferior borders of the inferior 8 ribs. Insertion is linea alba and the iliac crest. As you can see, there's a lot of connective tissue in the abdominal wall. The anterior abdominal wall is very important. You have these tendinous intersections across the rectus abdominis. This basically is what allows areas not to get expanded within the rectus abdominis so that somebody can develop a six-pack. You have the various sheets of connective tissue that go around the rectus abdominis called the rectus sheaths. They're formed from the external and internal obliques as well as the transverse abdominis muscles. And then, of course, each of the lateral muscles, external, internal obliques, and transverse abdominis, have their aponeuroses that leads into and forms that rectus sheath. You have the inguinal ligament at the very inferior border of the trunk and the linea albina straight down the midline, formed by a fusion of those three aponeuroses. All right, we have the internal oblique. It is deep to the external oblique. It's on the lateral sides. It compresses the abdomen as well as flex the vertebral column. Or singly, it can help to laterally flex and rotate the vertebral column. Origin, lumbar fascia, inguinal ligament, iliac crest, insertions, the linea alba, the pubic crest and inferior ribs 9 through 12, and coastal cartilage of ribs 8 through 12. Transverse abdominis is deep to the internal oblique. Together, the transverse abdominis can help to flex the vertebral column and compress the abdomen. Singly, it can help to laterally flex the vertebral column. Origin is the iliac crest and the cartilages of ribs 7 through 12, as well as the lumbar fascia and the inguinal ligament. And its insertion is the linea albina and the pubic crest. So here is a lot of the muscles in the trunk, the external and internal intercostals, the diaphragm, the transverse abdominis, the internal oblique, the external oblique, the rectus abdominis. Hernia is when a rupture occurs in the walls of the abdominal cavity and the intestines begin to squish through those holes, or it can occur through the inguinal ring in the inguinal ligament. This gets repaired basically by pushing intestines back down and putting in a mesh and sewing together that hole to prevent the intestines from continuing to get out. All right, muscles that support the pelvic region. So the bottom of the trunk, basically. We have the external urethral sphincter around the urethra. It helps to control urination, and the external anal sphincter around the anus that helps to control defecation. We have the ischiocavernosus muscle that helps to maintain clitoral or penile erections, as well as the bulbospongiosus muscles, seen here, which helps to narrow the vaginal opening, compress and stiffen the clitoris. Also helps to eject urine and semen in men and compress the base of the penis as well as stiffen the penis. Then we have the ischiococcygous muscle going from the ischium to the coccyx muscle, helps to support the pelvic viscera, resist intra-abdominal pressure, and pulls the coccyx anteriorly following defecation and childbirth. And then the levator ani, which is a series of muscles that help to form, so they're over here, a series of muscles that help to form the pelvic floor and support the pelvic viscera, as well as resist intra-abdominal pressures. Disorders of the muscular system, in Bell's palsy or facial paralysis, where one side of the facial muscles are not able to contract, so it's paralysis. Strabismus, where the two eyeballs are no longer properly aligned, also known as lazy eye, because one of the muscles isn't attached properly. Dysphagia, the clinical term for difficulty in swallowing. Rotator cuff injury, a strain or tear to the rotator cuff muscles, often from vigorous circumduction up the shoulders. Golfer's elbow, condition caused by strain of the flexor muscles as a result of repetitive motions. The groin pull, rupture or tear muscles in the thigh that move the legs medially. Pulled hamstring, strain or partial tear of the proximal hamstring muscles. And shin splint syndrome, where there's painless and soreness along the tibia, caused either by tendinitis, inflammation of the periosteum, or stress fractures within the tibia.